Angus Wallace, a Director of UKDHC. Today, I am delighted to introduce you to Professor Lesley Holdsworth, OBE, the Scottish Government Clinical Lead for Digital Health and Care, and also the Associate Director for NHS Education Scotland. She's going to talk together with James Freed, who is the head of NHS Digital Academy for NHS England. They were invited to our conference in September to give this presentation on how we have tackled improving digital skills for health and care staff in England and Scotland. We wanted them to bring us up to speed with how both Scotland and England were focusing on training their NHS staff in digital skills to ensure that we were delivering the best possible support to nurses, doctors, and allied health professionals in the workplace. Lesley and James, over to you.
Thank you very much for that very welcome introduction there, Angus, and it's really good to be here. On behalf of James and I, we have put this presentation together, which we hope that you'll enjoy. And it's about developing a digitally enabled workforce. It's the view from England and Scotland. And could we just caveat this to start with? We don't want to alienate our Welsh and Irish colleagues, but this is just our view from England and Scotland. We know there's some great work going on there as well. Anyway, so that's the apology done with straight away. So thank you very much. So as Angus said, I'm Lesley Holdsworth. I'm technically the clinical lead for digital health and care at the Scottish Government, and I'll let James introduce himself.
Hi, everyone. My name is James Freed. As Angus said, I'm the Deputy Director for the NHS Digital Academy, but I do, in fact, run it. And just to say, we are going to be using Mentimeter today, and we're going to be polling you. So please do either take a snapshot of that QR code or navigate to menti.com with that 8-digit code. In fact, it looks as if the code has changed. Use the one at the top, not the one in the text at the bottom. So I apologize for that. It's 56751426, but we'll have the code on the pages where we're going to be asking questions.
Brilliant. And we've introduced ourselves now, so we'll get straight into it. Thank you very much. I think we can quite safely say that in both of our countries, both in England and Scotland, we are both firmly agreed that we really need a digitally enabled workforce. And the whole transformation agenda that we're currently grappling with is really badly needed, but it's also entirely reliant on our workforce ability to know when, why, and crucially how to maximise digital. Our collective reports, a selection of them you can see here, our policies and strategies actually clearly articulate that need. We need those staff to be able to navigate a data-rich healthcare environment and have the literacy to be able to do so. We need them to think, to work, and to do with a digital mindset if we're going to have any chance of delivering the care and the services our citizens need. And why? So, so therefore, why do we really need a digitally enabled workforce? Over to James.
Thanks, Lesley. So I'm going to start with talking about all activity in health and care. And there's an element of that activity which is all about change. Most change is now underpinned by digital or data in some way. We've estimated it at 95%. When I typically ask people, a very small number of people say about 10%, a small number of people say about 100%, but there's a peak around 80 to 90% of change that people feel intrinsically is underpinned by digital or data. There's not a huge amount of data, ironically, data itself on that. But what we do have are indicators. So things like Moore's Law, which is represented by the chart here. Those of you who aren't aware, Moore's Law is a it's used as a predictor of power of technology, really, power of digital technologies. And similar to a number of other technologies, digital technologies are seeing an exponential rate of growth in terms of their power. Gordon Moore was one of the inventors of the computer chip, and back in the late 60s, he predicted a doubling of computing power as measured by the number of components on computer chips are about the same size and same cost every 2 years. And that trend has proved true even to today. That means that the total power that we've got through digital technologies and digital hardware is about double what that would be today in 2026, and we'll continue seeing those doubling every 2 years. I've also peppered this introductory section with a number of quotes that we have got from a learning needs analysis that we conducted across the NHS in England at the beginning of this year that adds a little bit of flavour in terms of what NHS staff from all walks, clinical, non-clinical, digital, non-digital, senior and junior, feel about the digital agenda and how they experience it at work. In this case, 97% of the 550 people who responded to our survey agreed that technology has the potential to support the work of the NHS, which is not hugely surprising. However, and this is the real kicker, and it's a stat that we need to talk about, 70% of all digital initiatives, regardless of industry, regardless of country, fail, according to or rather against the predictions made in the business case. This is supported by some good quality data. I've mentioned 3 pieces of work here: Forbes, the Harvard Business Review and McKinsey, all come up with similar stats in terms of the proportion of digital initiatives that fail. And this is very much implicitly recognized in the NHS workforce. If you think about the quality of the digital technologies that you use as a clinician or non-clinician in your day-to-day working in health and care, most of you will recognize that the digital technologies that are offered don't necessarily do everything that you might have hoped they did. And we also know that of those failures, 63% of them are down to cultural or skills deficit reasons. Only about 1 in 5, about 20% are down to budgetary constraints. Only about 1 in 5 are down to choices of technology or issues with the technology, but fully 63% are down to human related issues, things that we potentially could try and address with education programs, which is where people like Lesley and I come in. 98% of all of those surveyed, again across all of those different criteria, strongly agreed that digital skills will be important for their job in the next 5 years. People recognize that they need to develop in this area. So if I multiply those numbers together, 95% of all change that is underpinned by digital, but 70% of digital initiatives failing, and 63% of those failures down to cultural and skills deficit reasons, that makes a total of 40% of all change activity in the NHS that could be changed from failure to success if people did something differently, if they behaved differently. Now, these behaviour changes that are brought about, at least in part, by education, that can change the capability and the mindset of people are what we define collectively as digital skills. So you can see that Lesley and I are defining an extremely broad set of skills as digital skills that enable us as a workforce in general to be fit for the 21st century. Now, those failures creates real world problems. Our learning needs analysis, we asked people what their big issues with using digital and data were. And there are about 30 or so core issues that fell into 4 categories. There were foundational challenges. These included things like the fear and lack of confidence in use of technologies, outdated or ineffective technology, and lack of training or lack of time to train. That was also quite a big issue. There were challenges around the systems people were being asked to use, in particular, they didn't meet users' needs and that they were unreliable. Even when people were able to use those systems, that there were challenges with data and data processing that typically resulted in poor quality data input. And if you have all of these issues, and in fact they are compounding, it translates into real difficulties in making high quality decisions around the poor quality data that may or may not have been put in by people who may or may not have been able to access systems, resulting in challenges around overall decision making. Disappointingly, these issues are nothing new. If we conducted a similar sort of learning needs analysis 2 decades ago, we'd have had similar sorts of issues. What was interesting, however, is that we went on to ask people what it was that they felt people needed to know and who needs to know it that would directly address these issues. And it's those questions that have helped inform some of our thinking about how, as institutions that are responsible for delivery of digital skills, how we can make the most impact in the smallest amount of time.
That's great.
Lesley.
Thank you very much, James. Right, now is the first opportunity for you to contribute to this presentation yourself. And we're really keen to hear what your own thoughts are about that. So how well does this resonate with your own experience?
So please do navigate to menti.com, use that code at the top. I suspect if you tried using the QR code earlier, it wouldn't have worked. I do apologise that. I also appreciate the irony of us talking about digital skills and us trying to use a digital tool that hasn't quite worked according to our plans. That's entirely on me. You can't blame Lesley for that one.
Well, I don't know about that. James has done all the power work behind the scenes, as you can. So just give you a few more seconds there for you to log your preferences here. Okay, I think we're getting a flavour there. Obviously, your experience sort of resonates with ours and the picture that James was presenting there. So that's really good to hear. So we're all coming from the same place. Excellent. Good, good, good. Okay, so what are we actually doing about creating this digitally enabled workforce then? And let's hear from England and Scotland.
So I'll start, if that's okay, Lesley. What you see in front of you is what we call our logical model, or our model of change for the overall digital academy. And as you've heard, the way that we have tested this is by undertaking a large number of one-to-one user interviews and a survey to try and understand who needs to know what in order to shift the biggest problems that we have and we experience today around the use of digital and data in the NHS. Our overall mission is to try and help NHS services deliver more value more quickly through the levers we've got. So specifically access to the right skills, data and technologies to enable people to do their jobs better, in short. What our learning needs analysis did is it really crystallized two core problems. Firstly, NHS staff don't always feel as if they've got the confidence and competence to use the digital technologies and data we ask them to use on a daily basis as they need to perform their role. So there's something around all staff digital competence and confidence. Secondly, what we heard really, really strongly is that the digital technologies and data that we ask people to use on a day-to-day basis are fundamentally not usable, or in some cases not available. And that is because they've not been designed around meeting the needs of both users and the organisation. So we've turned those around a little bit into two outcomes. We need all staff to be confident and competent, and we need all digital technologies and data to be both available and usable. But when we did our learning needs analysis, it became clear that different actors had different impact on those two outcomes. Primarily, trying to address all staff confidence and competence is it's an all staff issue, and a key part of our work is around how we assess and educate or provide assessment and education for all staff in the NHS to help them use technologies and data that they are given to use. Sometimes that's very specific. How do I use Cerner Millennium to order bloods? Sometimes it's very general. How do I turn on a computer? How do I use a mouse? And all of those skills are captured in that top box on the right-hand side as our first activity. The second community that really came to light to try and address that first confidence and competence issue is the educator community. And we'd not quite appreciated quite how large that group is. In England, it might be 1.2 thousand, maybe 2,500 people who are specialised in being educators embedded within health and care frontline institutions, whose job is to support the learning and development of staff within those institutions. What they told us was that they needed help in undertaking that work. If I move down to the bottom, what I might call the root cause, which is the technologies and data that we offer people as unusable or unavailable, there are two broad communities that are addressing that. So if I look at the bottom two boxes on the right-hand side, the first is our digital data and technology professionals, and we need to develop education and career structures for them. And the second is a large number of managers, budget holders, project managers, people who are empowered to make changes to services that currently are not necessarily doing so correctly. And then we've got a group of people right in the middle on the right, which is our senior leaders, both digital and non-digital, so chief information officers, chief clinical information officers, but also chief executives, chief finance officers, chief operating officers, and non-executives, and how we support the education of those people to create the right digital culture and make the right digital decisions. And collectively, our research indicates that those five levers together are likely to make the biggest impact on those two outcomes. They are hypotheses, and we do need to test them. But that's the logical model for England. Lesley, is yours similar?
Well, surprisingly so. I think it's very similar there, James. Quite interesting. I think what I should be saying is that our digitally enabled workforce team, of which I have a very close relationship with in terms of our whole workforce development around digital, are based within NHS Education Scotland. And we also conducted a similar exercise, as James has explained, that his team did. We involved key stakeholders and subject matter experts, etc., to develop our own logic model. And not possibly unsurprisingly, and also reassuringly, it's quite similar to the output that James has just shown you there. So again, our missions are very similar. We want in Scotland an NHS that supports safe, effective and efficient care in the digital age, in a digital society. And from our outcome, what we're trying to achieve is to have that workforce with the capability and confidence to use data information technology effectively in their role. Interestingly, we also have our blogs there on the side about what we must get right. And the picture is very similar to the previous slide that James has taken you through. Again, we recognise that our most senior leaders must have that mindset to be able to drive the culture that empowers organisations and allows them to innovate and to transform there. And again, when we're talking about senior leaders, yes, we need our senior clinical leaders, we need our senior technical leaders, but we do need those people sitting around the board table as well. We need resources that are available for all the workforce, doesn't matter where they sit within any organisation. So they need to be accessible and obviously and really relevant. And we'll probably come on to talk a little bit about that as we go through the presentation. We put quite an emphasis on the development and on the ability to actually interpret and use data. And in fact, Scotland last year published its first ever data strategy in recognition of that. And it's got a meaty section about how what actions we need to take to actually develop these capabilities within our workforce. And again, James referred to the DDAP professionals who are critical to us really making progress and advances in this with this whole agenda. Understanding workforce needs. There's this word here, gap. I'm not particularly comfortable with that, if I'm honest, because gap to me implies a total void. And I don't think we do have total voids. I think we definitely have shortages of skills in certain areas. We definitely have deficits and needs. But I personally would sort of remove the word gap a bit from there, but it was a collective effort, so my dictatorship doesn't extend to that. We also need to create these networks throughout Scotland of digital leaders, digital champions, etc. And that whole issue that James really figured possibly even more highly within their logic model was about that we have that accessible and relevant technology that is no good developing everybody's skills if we don't have the technology that can meet their needs and also their preferences audiences there. And finally, we want a whole engaged community there. So this is what our logic model looks like in Scotland, and it does form the basis of our delivery plans that we renew on an annual basis. And I'm sure we'll come on now to explore what that really means in a moment. Thank you, James. So, okay, so we've explained what our logic models, what our visions, our missions, and what the outcome we're trying to achieve, both in England and Scotland. And we'd really be interested in your own thoughts about that. We really want to know, does this resonate well with you? Have we got it right? So if you could use the Mentimeter again, and let's see what your own thoughts are about this.
Should say, it occurs to me, Lesley, at this point, we're being quite brave by asking people in the middle of a presentation by whether what we're doing looks right to them. But it's super useful feedback for us. And at the moment, what we're not trying to do is ask you to pick apart which logic model you prefer. That we think there are enough similarities between these that we can take them together.
That's good. We're really, as James said, we're not precious about any of this. We always are very keen to have feedback. So if you want to write anything in the chat as well to perhaps pad out some of your thoughts around some of your responses in relation to the Menti questions, we'd be delighted to take those at the end, or even take them away or have further conversations.
Lesley, can I just reinforce that? If people can put their questions in the chat, I'll pick them up and pass them on. And I won't hold back.
Thank you, Angus.
Thank you, Angus.
Excellent.
And just to say, we do have a slide right at the very, very end, which is a free text one. So for those of you who've put down that you think that there are some big gaps in our logic model, Lesley and I can be really super keen to know what you think those are, so we can address them. And you'll have your opportunity. So do tell us.
And it looks like people might have a lot to tell. Always helpful. Thank you.
Right. So then this next section of our talk, we wanted to tell you what we're doing for these different user groups. Although we've got slightly different logic models, there's a huge amount of similarity, as we've said. And we've divided up how we are trying to tackle education into some broad user groups, and we've picked 6. So we're going to be telling you a little bit about what we're doing for all staff. So trying to address the sort of basic digital and data competency and confidence type skills, what we're doing for middle managers, those people who've got some responsibility for running, designing or redesigning services, who need to make decisions increasingly about digital, because digital is underpinning more and more of the change that they're trying to undertake. What we're doing for senior digital leaders, what we're doing for board level leaders. So these are the non-digital people who sit at board level. What we're doing for the digital and data specialist workforce, and what we're doing for the educator community. And we're going to take each of these 6 individually, starting with all staff. So what we mean by this is anyone employed by health, indeed in some cases care organisations, that are being asked to use or may benefit from using digital technologies and data across England and Scotland. The estimated workforce size in the NHS is 1.58 million people, which is not a small number. And the problem statement is that 63% of healthcare staff across the UK cannot undertake all 20 essential digital skills for work. I'll explain what I mean by that in a minute. Now, for each of these 6 categories of staff, we've included a quote or 2. In this particular case, the quote comes from the Learning Needs Analysis, and 14% of people who we surveyed felt that they did not have the digital skills they need to do their job right now, although these individuals strongly agreed that digital skills were important for their role. Importantly, lack of basic digital literacy was not isolated to specific job roles or levels of seniority, nor was it necessarily age related. And there's a huge number of misinformation about digital literacy that is causing us to direct our efforts in sometimes the wrong places. Some staff may also be computer resistant, relying on colleagues to complete the digital components of their work. And there are all sorts of cultural issues that are tied up with that as well. So let's just have a look at the data around this group for a second. I'm going to be drawing on some data not produced by the NHS, actually, but produced and published by a company called Future.now, who work in partnership with Lloyds Bank. Now, Lloyds, every year for the last 5 years, have run something called the Consumer Digital Index. If you've not had a look at it, please do Google it. It's really super interesting. They poll through Ipsos Mori about 5,000 people across all walks of life across the UK. So not England-specific work. And they poll people against something called the Essential Digital Skills for Work framework. It's a very simple capability framework. It includes 20 skills. And what they noticed was that the factor that correlated most with digital literacy, with people's ability to undertake these skills or not, is not age, it's not where people lived in the country, it's not seniority, it's not academic attainment, although all of these things are linked. The strongest correlation was with the industry in which you work. Whether that is the requirements of the industry or whether it's the recruiting behavior or the sorts of people it attracts, we don't know. But we do know that the industry in which you work is more of a correlator to digital literacy than any other factor that was looked at. There was an industry that they call medical, which actually means healthcare. And in that category, you can see that as an industry, we are below average in comparison to the UK workforce as a whole. Healthcare is less digitally literate than the average across UK workforce. What that means is only about 37% of people working in the NHS have all 20 skills, essential digital skills for work, what I might categorize as people who are ready to learn to innovate. This is only core digital literacies, things like knowing that a padlock in the corner of your browser screen means that that browser page is secure, for instance, is those, or being able to access your payslip online. It's basic digital skills. Fully 48% are somewhere between having 5 and 19 of those 20 skills. What I might say is having some sort of basic training and needing a bit more basic training before they're really able to innovate safely. And 15%, 3 out of 20 people in the NHS do not have 5 of those 20 essential digital skills. And probably about a third of those, probably about 1 in 20, about 5%, have got none whatsoever. Digital literacy is a significant problem in the NHS. Lesley, what are we doing about it?
So, as James has really painted this picture for you, I thought that I would explain what we're doing in Scotland in terms of digital and data capability. And hot off the press this year, we have, in fact, last month, published our first ever digital and data capability framework, which is also supported by a self-assessment tool. And it consists of 6 different domains, as you can see here. And can I just say that this framework has been developed very much for all staff. It's not meant to be an in-depth competency framework for the informatics community. Very much we do have, still have the wonderful and very excellent one that was developed by the FCI. But this one has been developed so that it applies to all staff. We need to know how they rate in terms of their skills, knowledge, and behaviour, and how they can actually do their everyday job within the NHS. Our intention, obviously, as I say, this is very new and only published last month. But our intention is to introduce this into induction packages so that everybody is taken through the capability framework. It's good for individuals because they can identify where their skills shortages lie, but also where their strengths are. But we'll use this nationally as well. We'll encourage all staff to undertake the self-assessment. We'll use this actually to influence our national training programs and resources that we offer there. It's good for organisations as well because I have a strong belief that organisations don't understand where they need to put the emphasis on their local training, but also they don't really understand where the strengths lie either, and they're not optimizing this for the benefit of their own sort of innovation and advancement there. So this is one of the offerings that we have in Scotland in terms of trying to capture exactly where our workforce needs lie. We've also have a range of resources that are available to the full workforce. And this, when I say that, I mean across health and social care. Through our education provider, NHS Education Scotland, we have quite a robust and rich range of resources that can be accessed by anyone who works in health and social care in Scotland. For example, we have this resource hub, and this has now been aligned. The activities that are available within the hub have been very much aligned with the new capability framework. They are so that, for example, if you undertake the framework and you identify that you could do with a bit of upskilling in certain areas, then it maps directly across there. We have a Microsoft 365 skills hub, which has a range of resources available there. They also put on weekly webinars. They respond to people's requests for help, etc. So we've got a whole stream of work in there around Microsoft 365, which I'm sure that in your experience will be similar to ours, is that we're not optimizing the functionality to the degree that we need to be doing, that we could be doing to benefit us in our work. We also have a program of work around our digital champions. I don't have to tell you about the value that these particular networks can bring. And we support those fully nationally. So that's just a little snapshot of some of the resources and some of our areas of work that we are undertaking that are open to every single member of our workforce in Scotland.
Thank you, Lesley. What I'm showing you here is a number of different things that exist for the English NHS. So we also very similarly have a capability framework with a self-assessment tool associated with it. It's called the Digital Self-Assessment Tool, or DSAT. 450 organisations have signed up to using it. We've had more than 18,000 people use it. And it is linked to 280 accredited mostly bite-sized pieces of online learning, actually, to try and address very specific digital literacy gaps in our workforce. But the reason I'm showing you this slide is to demonstrate that we're not alone. In fact, there are a large number of organisations who tried to solve the digital literacy issue through different lenses. I've mentioned the Lloyds and Future.Now work, and their aim is to try and support the whole of the UK workforce in something similar, actually. And they have ambitions to create similar self-assessment tools and provide access to free learning to UK PLC, in short. Individual organisations, Hertfordshire Partnership Foundation Trust, Surrey and Borders, both have their own approaches to trying to support digital literacy. They sometimes use the tools that we provide nationally. They sometimes develop their own. And some professions, in particular, the RC Psych has developed its own data and digital literacy framework for psychiatrists. Something that we did do initially was start off trying to understand the digital literacy needs of different clinical professions. But we quite quickly found we did work around nursing, AHPs, and pharmacists, and we found that the sorts of skills we were seeing were being repeated. There were sometimes some specific requirements, often around specific technologies or modalities, but they were definitely in the minority. More than 95% of those frameworks are comparable. So let's move on to the second group of people who we've called middle managers. So these are people who've got some sort of responsibility in running, designing, redesigning clinical and non-clinical services. They're increasingly using digital to inform those changes and to underpin those changes. But most of these middle managers are not trained in digital and making good decisions around digital tool selection or indeed implementation. It's not a small area of the workforce. In other industries, this group of people might be as many as 50%, 51% actually, of people in other industries around the world fall into this category. And the problem statement is they're increasingly using digital more and more to solve problems, but it's being bought and implemented by people with no skills in implementing digital technologies. What we were told when we undertook our learning needs analysis, that when in particular clinicians were being asked to use digital tools on a day-to-day basis, they may have to log into as many as 11 different systems. Each one may be taking 20 minutes to log on to. Although obviously there are technological solutions to things like that, it's the fact that we were ending up in a situation where people were being asked to log into 11 different systems that really highlights the fact that the people who are responsible for implementing them do not understand the problem from the user's perspective. They're just not creating a world in which the technology we're asking people to use is fundamentally usable, which is much more than just how you're interacting with a specific digital tool. It's how you log onto it, it's how many that you need to log onto, it's what your work process is like. This is the slide I was referring to. So 51% of people in other industries now are trying to use digital technologies, building data or technology solutions for work. 4/5 of them, 41% of the workforce, are not working in a centralized IT or digital department. We estimate that those numbers are smaller in the NHS, but probably not hugely smaller, which is where our estimates come from. In short, this is an important and significant group that we need to try and address. Lesley.
We've also recognised the importance of this group of individuals. And in fact, going back as far as 2013, we introduced our first digital health and care leadership programme, which was focused on the MMAP community originally. That's nurses, midwives and the allied health professions, who actually make up 73% of our clinical workforce in Scotland. And this was in direct need to what was being asked of us. So we started a programme, and that has evolved significantly over the years and really escalated. I think 2020 was quite the watershed for many people, and particularly those of us heavily involved in this agenda. When we really realised that we needed people with the savvy, the confidence, the knowledge, etc., to optimise what was with the existing technologies that were available to us. So we've expanded this programme considerably, and it is now a 9-month programme aimed at the mid-grade, middle managers, those who have some responsibility for making decisions in their workplace. We have 2 to 3 cohorts per year of roughly about 90 individuals on each cohort. And it's open for all professions. It went beyond the MMAP community in 2016 because of the demand from all professions. So we have a truly multi-professional, multidisciplinary group of individuals who go through this learning programme over a 9-month period and undertake a project in their workplace to actually to embed some of that learned knowledge, etc., as they go through the programme. Demand for this still astonishes me. We've just started cohort 24 last week. Demand for those places outstripped our capacity by 5 to 1. And we're really looking at other ways that we can ratchet this up even more so. It's very much embedded in peer support. So that is a fundamental thread of the programme, a lot of peer support sessions and some great stories. The other, just one point I want to make about the learning from this particular approach is we've moved into encouraging as many team applications as wish to come forward, because I think if we actually think about the way we deliver our services, our health and care, we very seldom work as individuals. We do that as part of a team, and that is where the benefits really could be realised. So at the moment, we have, I think, 4 different teams. We have a public health team, for example. We have a renal team, which consists of the consultant, the nurse, the pharmacist, even the admin support. They all come together and learn together and undertake a piece of work to drive this forward. And that has been incredibly well received, and we're seeing some fabulous outcome from that. But it's aimed at that mid-career, mid-manager level. So that's what we're doing in Scotland at the moment. We also have a series of digital leadership webinars that are held on a monthly basis. People can suggest topics. We get subject matter experts to come. It's just about creating that curious community, really. So I'll just stop there and come back to James.
Thank you. So in counterpoint to what happens north of the border, we don't have a single course aimed at supporting middle managers who are not digital professionals, but we do have a number of bite-sized courses for specific topics, sometimes around clinical safety, some around supporting commercial and finance managers in collaboration with the HFMA. That's the picture in the bottom left. We've got a digital first program, which has got an 8-week course aimed at supporting decision makers around an introduction to user-centered design and user research. We have a portfolio of education aimed at supporting people with a primer for the use of artificial intelligence technologies, all of which are openly available. We're also currently working with the Chartered Society of Physiotherapists in developing effectively what is an introduction to clinical informatics, 3-week online e-learning course, which we'll be sharing with the 4 nations. So that'll be an offer that we open across the UK. Let's talk about board level development for a second. So these are the most senior people in an organisation responsible for setting the vision and overall strategy of an organisation and ensuring that the culture of a whole organisation fosters innovation as well as safety. We estimate we're talking between about 2,000 or 3,000 people across England and Scotland here. And the problem statement is the digital world is demanding change to happen faster and faster, and doing so requires organisations to behave differently. It requires them to enable more and more people to deliver change in key services without compromising on safety. And this culture, changing culture, as well as the inculcation, the creation of guardrails to enable safety to happen without hierarchy, without delay, is a really tricky thing that we're trying to help boards wrestle with so that their organisations are fit for purpose for the 21st century. Lesley.
Very similarly, we've also recognised and actually set out in our annual delivery plan the need to do some development around that board table there. As James has said, that these individuals are quite key. They set the cultural tone. They set the appetite for risk of an organisation, and we all know that innovation will not happen if the organisational approach to risk is quite averse. We need it to be really open. So we've embarked on a programme over the last year of developing our board executives and non-executives, but also trustees from the local authorities, etc., and the third sector. This offering is made available to. It comes in 3 parts, a asynchronous 1-hour video. We have built a whole website of resources that consists of talking heads, key must-reads, as well as the sort of dry policy stuff, etc., and an ability for people to interact with others. And then finally, there is a half-day interactive small group session that no two of these have been similar, and we've delivered this already to over a couple of hundred people. It's a really interesting area to develop, and as I say, I think for us in Scotland, this will be an ongoing commitment.
In England, we've got a very similar product. In fact, we've got two similar products, one aimed at trust boards called digital boards, one aimed at integrated care systems called digital ICSs. Both are provided through NHS providers as a trusted partner for board level education. Pretty good coverage. So about half of all trusts, about a quarter of all ICBs have been through a formal, at least one formal 4-hour development session. We do have metrics on success. So the bottom left is demonstrating a before and after improvement in all 8 digital leadership characteristics against our framework for boards, for one particular board, one ICS. And on the right, you'll see a quote. We do try and follow up with each of our boards to find out what difference the sessions have made. And this particular ICB has stated that they're now investing more heavily in data, which is expected to release £2.2 million worth of savings within 5 years. They may well have got there on their own over a longer period of time, but they have highlighted that the board development session was one of the key triggers to making these changes happen. Let's move on to senior digital leaders now. So these are the people who are organisation-wide digital leaders responsible for setting up core infrastructural digital services. And I mean that word in its broadest sense, not just boxes and wires, by the way, who need to make sure that investments are correct, culture is aligned, and digital guardrails are in place. So typically, these are the chief information officers, chief digital officers, chief clinical information officers as well, of all clinical backgrounds. They could be clinical and non-clinical. Based on our census data, we're estimating the size of this group of people to be about 1,000 across England and Scotland. It is growing. And the problem statement is that the digital world demands all the changes that I've been talking about before, but the CIO, CCIO is often the gatekeeper for an organization adopting a different mindset. They can be a real accelerator of digitally enabled change, but they can also be a blocker as well. And they can make some decisions which are incorrect, leading to organizations taking a step backwards in terms of culture or digitally enabled, safe digitally enabled change.
So we will wrap this up pretty quickly then. Just to say, we also have a programme for our senior leader, which was very much based on the wonderful UK Digital Academy. It launched last year, and we've just started cohort 2 of that, but to achieve the aims that James has outlined there.
That's my equivalent. 7 cohorts so far. So we've trained 600. The 7th is about to start in September. And we also have a programme. The digital and data specialist workforce, about 45,000 people. This is both clinical and non-clinical.
And equally so in Scotland, we are also offering a range of development opportunities for these very important individuals.